Welcome to KTN News Health Watch. I'm Dr. Mercy Korir. This week, the world got a breath of fresh air after Pfizer and its German counterpart BioNTech announced that its Covid-19 vaccine candidate showed promising results in combating the coronavirus. With dozens other vaccines in the phase 3 of their clinical trials, this might be an indication that the world is edging closer to getting a solution to a pandemic that has wreaked havoc globally. Our health and science reporter Beldine Waliaula takes a look at the journey towards getting a vaccine for this virus.
The breakthrough in the quest for a COVID-19 vaccine might be the signal that the pandemic will end soon. Less than a year after the first case of COVID-19 was reported, scientists have broken the record in coming up with a promising vaccine candidate compared to normal time, when this will take more than 10 years to develop.
It is a great day for science. It is a great day for humanity when you realize that your vaccine has a 90% effectiveness. That's overwhelming. You understand that the hopes of billions of people and millions and businesses and hundreds of governments that were felt on our shoulders, now we can credibly tell them, I think we can see light at the end of the tunnel.
Pfizer and German biotechnology firm BioNTech says that their vaccine is 90% effective in protecting people against COVID-19 in their early trials. The pharmaceutical hopes to manufacture 1.3 billion doses of the vaccine by the end of 2021, if all goes well.
This will be coming gradually. In the beginning, a little bit less, then the first quarter more, the second quarter more, and then we have a significant ramp up in the second half of the year to deliver the 1.3 billion. But given how effective this vaccine is, and we are aware that the demand will be much higher than anything we can produce, we are also looking right now to see if there are other ways, thinking out of the box, that will increase even further the manufacturing capacity.
When the vaccine is ready, countries like Canada, countries in the European Union and the United States will be given first priority, which means other countries, including Kenya, will have to wait.
It's not for Pfizer to decide who will get the vaccine. I think it is for the health authorities of every country, and in many cases within the same country, of every region or of every state in the US, for example, because the situation differs from state to state or from country to country, and you need to tailor it to the needs of the specific geographical region.
But there are other vaccine candidates in the last stages of trials, known as phase 3 clinical trials. These are by Moderna, Johnson & Johnson, and the ChAdOx1 vaccine from Oxford University and AstraZeneca, in which Kenya is participating in the clinical trials. With such hopes, the question remains, is it too early to celebrate?
Now we are joined by Dr. Rudy Eggers, who is Kenya's WHO country representative, to further have a discussion on this issue of the vaccine. Thank you, Dr. Rudy, for joining us for this particular conversation. Now, there is good news that we have a vaccine that is showing very, very promising results. What does this mean to the fight against COVID-19?
We've got a vaccine that is proven to be both safe and effective in 90% of cases. That being said, of course, this is one of the vaccines of the many that are out there. So there are 47 candidate vaccines, of which 10 are in the final stages of their trials. And the Pfizer vaccine is one of those 10. So there's a whole pipeline of vaccines of different kinds, different ways how they are put together that are in process. So while there was, of course, this big announcement by this pharmaceutical company, there are others that are also in a similar situation. But for everybody that's waiting for this is really good news that we have got some evidence that this vaccine will actually assist us in the control of COVID.
If the other 9 or if the other remaining vaccines succeed, Is this a good thing, or would it mean that we have many vaccines whose side effects or whose effects will not be able to really understand? What does this mean?
It's really good that we don't have just one vaccine that we rely on, because even through the trial, there might be things that have been missed, or in fact, there may be other vaccines that are even more effective or have other profiles, can be used in other population groups. So the fact that you have more than one vaccine is a very positive feature of this. So it actually allows us to also spread the number of vaccines that we have worldwide. You must realize that everybody in the world, of course, is interested in this vaccine, and just having a single one would make it much slower than having several possibilities. The different vaccines are also...
Back to the continent, where does Africa lie, considering that, the developed world has been on a mad dash, to book or acquire, pre-purchase the vaccines? Where does Africa lie? Where does Kenya lie in this, food chain in acquiring the vaccines?
This has been one of the concerns, of course, from WHO, specifically Dr. Tedros, the Director General of WHO, has repeatedly stated that it's very important that there's some equity in the distribution of this vaccine. Obviously, those countries that have got either the production facilities or have financial strength have got the ability to engage in this directly. But for the many other countries of the world, including many of the countries of Africa, WHO and several partners, including the Global Alliance for Vaccines and Immunization, and other partners, especially also the World Bank, have come together to actually support this provision of vaccines also for the rest of the world, the other countries such as Kenya. So this will mean that for these countries, either through a mechanism of self-financing or through a support provided through the World Bank and Gavi, there will be access to vaccines as they become available.
So is covering 20% of the population adequate? And I know there's also been a focus on covering healthcare workers. Will this be adequate in being able to control and contain the pandemic?
In fact, ultimately, you want more than 20%. You want most of the population to be vaccinated, like you do with measles vaccine or other vaccines. In the context where you have a great scarcity of the vaccine, it is important that you target those that need it first. So it is really the first step. This 20% is seen as the first step, and that will enable countries to target health workers. I think are quite important. Those people that will take care of the sick when they need to. But then also there might be elderly populations, people with comorbidity, those people that we know that are most severely affected by the disease surely should be vaccinated first.
Seeing that these clinical trials are happening in small populations, like the Pfizer vaccine was among almost 44,000 people. It's thousands of people, yet we have billions of people in the world. How sure are we about the safety profile and the effectiveness of these vaccines?
The first step, phase 3 trials are the first step to actually going in that route. Once you are introducing the vaccine, one of the critical parts and the thing that WHO and also the regulatory authorities within the country pay a lot of attention to is to make sure as the vaccine gets introduced that there are mechanisms of assuring that if there are negative effects or side effects that relate to the vaccine, that they are identified very rapidly. Because surely as you roll out this vaccine, you will be treating many more people, and it might be that there are side effects that appear only in 1 in a million cases. You would not pick that up with the 40,000 that you have tested now. But that's why you have to have a system in place that once you roll it out, you are very particular in finding out if there are any additional side effects that you have not noted. Clearly, this is a balancing act between dealing with the outbreak itself, the COVID outbreak, and the need of the population to be protected, also to get back to their place of work and the economic access that they want to have. And you want to balance that against the quickness of production of the vaccine.
From your position, you're able to see Kenya as a country, as a nation, and you also have a global view. How are we doing in terms of now being able to contain the pandemic?
Well, Kenya is now in the situation, of course, where there is a surge of cases. So on the African continent, there are a handful of countries, among them Kenya, that actually have rising numbers of cases and rising number of deaths. So we are actually in quite a precarious situation at the moment. We don't know where it will end, but the directives provided by His Excellency the President are going already in the right direction. The restriction of large gatherings, be it political gatherings or other gatherings, the reduction of in-person meetings and those kind of things are really important to get a new handle on this disease.
Thank you very much for your time, Dr. Rudy Egas, who's Kenya's WHO representative. Now we go to your questions, and Dr. Githinji Gitahi, AMREF's global CEO, is here to answer your questions on chances of reinfection after one has gotten coronavirus.
If someone has had COVID-19, can they be reinfected?
We know now, of course, the science and the evidence for COVID-19 is evolving, but what we know now is that it is unlikely to be reinfected. We know that for many viruses, the body develops some form of immunity and learns the viruses and therefore builds up immunity against the same virus in future. But of course, we also have a few cases where there has been reports of reinfection, minimal. They are not the majority, so this is kind of the exception rather than the rule. And when those infections have been reported, we do not know whether it's the same infection that has reemerged, whether it's the same virus elements that are in the body and therefore have tested positive, or whether it's true reinfection. So we know that reinfection has been reported, but I would like to say it is the exception rather than the rule.
In Kenya, do we have reinfection cases? And can you estimate the reinfection cases?
No, you can't, because they are far and wide between. Not like a significant portion that would be statistically significant. They're just cases of isolated cases of reported reinfection, but not statistically significant. We must also remember that this is just the first year of the virus, so we do not know whether this immunity that the body has developed after the first infection is going to last for a lifetime, is going to last for a year, for 2 years. So we do not know what the rate of reinfection could be in future. If the immunity developed by the body is not long-lasting, then we may see increasing reinfections in future.
We have had people get antibodies after getting infected with COVID-19. What does it mean?
Is protecting itself against attacks of any form, viruses, bacteria, fungi, parasites like malaria, whatever attacks the body that is not part of the body has a mechanism of self-defense. That mechanism of self-defense is what we call antibodies, meaning the body develops certain components within its blood that help to fight incoming foreigners or foreign bodies or foreign bacteria or foreign viruses. Now, these antibodies are developed and they are very specific or very near specific to the actual enemy in the body. So if you have measles, for example, the body develops certain antibodies. So the body learns and studies the virus. It then develops certain elements that can be able to fight that particular pathogen or that particular foreign body. These are what we call antibodies. So every disease that attacks the body learns it and develops antibodies. So for COVID-19, when you get infected with the virus, the body learns the virus that causes COVID-19 and develops antibodies. Those antibodies are the ones then that are built up the body, and they create almost like memory in the body that if we see this virus again, this is how we are going to fight it.
That's all that we had for you on this episode of KTN News Health Watch. We'd like to hear from you. You can send us your feedback on 22155, that is via SMS, or you can interact with us on Twitter at Dr. Mercy Korir or at SD1 Health. Stay safe, keep physical distance, and maintain hygiene at all times. I'm Dr. Mercy Korir.